The Honorable Judge Murphy presiding. Good afternoon, Your Honor.
Good afternoon. Good afternoon, everyone. Thank you. You may be seated. We'll have the witness back in the witness stand. Thank you. Yep. Come on up. Have a seat. And I just want to remind you that you do remain under the obligations of the oath that you took when you first entered the witness box, okay? Thank you. And Attorney Smith, you're welcome to come up at any time.
Thank you.
All right, welcome back, ladies and gentlemen of the jury. It's all right. All right, counsel, at this time, I would like you to please stipulate to the presence of our jurors.
Defense stipulates, Your Honor.
All right, thank you so much. Attorney Smith, you may proceed.
Thank you. Okay, Mr. Connory, let's see if I can reorient myself to where we were. Okay. I think you had just told us that a Shelton High School kid threw a punch, but you can't recall who that person was, right?
Correct.
How far away were you from where the person threw the punch?
I was at the mulch pile, so 5 to 10 feet.
5 to 10 feet away.
Yeah, that's about that from the.
You couldn't tell who it was that threw the punch,
No.
but you could tell that it was a Shelton High kid.
Yes, it was from someone's back. Someone's like their backside was towards me.
And you said that when you ran over to where Ryan Hines and Raul Valley were fighting, that they were just tussling, right?
Yeah, they were fighting.
No full punches were going on.
I don't recall the specifics, but they were fighting.
And they were fighting on the ground, right?
I don't think so.
And you said at some point you took Mr. Hines's place after you'd pushed them apart, right?
Correct.
And that you made eye contact with Mr. Valley, right?
Correct.
And in fact, when you described that to Officer Bango on July 9th, you told him that he stared into your soul and made creepy, demonic eye contact with you, correct?
Yes.
Demonic eye contact?
It was eye contact of someone who knew what they were going to do. It looked very unpleasant and very scary.
And then you said at some point the fight just stopped, right?
Yeah.
Do we see the fight just stop on that video?
No, it keeps going.
So this end of the fight where it just stopped, that occurred sometime after the end of the video, right?
When I referred to the fight just stopped, that's referring to when me and Raul have separated.
Okay. So after you and Mr. Valley separated, the fight continued, right?
Yes.
And who did you see involved in the fight at that point?
I don't recall seeing what happened after that point.
Did you see Faison Teal?
No, I did not.
Did you see Matthew Lockovich?
No, I did not.
Did you see Alex Bernson?
No, I did not.
Did you see Tanner Chernowski?
No, I did not.
Did you hear Tanner Chernowski?
No, I did not.
I'm going to ask you to watch what is labeled as State's Exhibit 60, and if we can see the 25% with the frame numbers on them, please. Your Honor, may I approach
Yes.
that and see? And I may ask this to be paused at various points, okay?
Okay.
Yes, sir!
Pause it right there, please. Do you see at frame 330 the person that you've described as Ryan Hines?
Yes.
And is he the person to the left of the screen wearing the green sweatshirt and the black shorts with the white trim?
Yes.
Can you play it again, please? Just from where we are. Did you see rain falling through the course of that video?
Yeah.
Do you recall it being misty and rainy that evening?
Yes, I do.
Do we have the ability to go to certain frame numbers on there? Yeah. Okay. Can you take us to frame, just start at the beginning at frame 0? Okay. This is the very beginning of this video, correct?
Correct.
And in this video, I'm going to point that on this screen because I can't
Okay.
see your screen. Do you see the green sweatshirt, black shorts with white trim here to the right-hand side of the screen?
Yes.
Do you see beside that a pair of lighter colored shorts with a dark shirt on the top?
I'm sorry. I can't see where you're pointing.
I'm sorry, just to the right of the person you've described as Ryan Hines.
Yes, I can see that.
You can see that on your screen as well?
Yes.
Is that you?
No.
You were wearing a dark top and light shorts that day?
Yes.
And who is that?
That's not me.
How do you know that's not you?
Looks like there's a logo on the back of the shirt.
Okay. Can we go to frame 10, please? And I'm going to point here on this screen again. Do you see the green top, black shorts with white trim that you've identified previously as being Mr. Hines?
Yes, I do.
And do you see beside him the dark top with the graphic on the back and the white shorts?
Yes.
And do you see beside that another person apparently wearing light shorts and a dark top?
Yes.
Is that you?
Not that I recall, no.
You recall telling us that you were close to Mr. Hines, correct?
Yes, but before the video is when I had my interaction with him.
Before this video is when you had the interaction.
Yes.
Okay. And can we go to frame 14? Have a little trouble zooming, getting to that pinpoint. Okay, that's fine. Let's go with 16 there. Oh, okay. And do you see in frame 14, again, green top, black shorts with white trim over to the right-hand side of the
Yes,
frame?
I see that, yes.
And do you now see two people with lighter shorts and dark tops, one of which has a graphic on the back, one of which does not appear to have a graphic on the back?
I see they both have graphics on the back.
When you say they both have graphics on the back, the farthest one to the right, you believe that's a graphic as opposed to that person's head?
Yes, it looks like a graphic to me.
What color shoes were you wearing that evening?
White.
Would you agree that these two people both appear to be wearing white shoes?
No.
No. Okay.
That looks like black.
And can we play through to frame 29. I want you to pay particular attention to frames 25 and 29. Can you see the counter on the bottom?
Yes, I can.
Do you see from frame, here we are at 22, is there a way to make it progress frame by frame?
Oh.
Do you see now, okay, here we go. Let's stop there. Did you see those two people kicking their legs?
No.
No. Is there a way to, does that have a playback speed on it? Slow it down? I really just want to focus in on 25 to 29.
Yes, sir!
Okay. Can we go back then to frame 79? Thank you. That's fine. Yes, thank you. Perfect. Now, can you see this on your screen as well?
Oh, yes, I can.
And do you see sort of center left, again, Mr. Hines, green top, black shorts, and white trim?
Yes, I see that.
And do you see this person with dark pants, a white top, and some sort of multicolored graphic on the back?
I can't see where you're pointing, sir.
It's to the right of Mr. Hines, sir.
Oh, you're talking about the, looks like long black pants, like the closest person?
I think so, yes.
Can you point it again? Because yeah, actually, I'm sorry, you're blocking my vision.
Do you
really
have
no
the-
way for me to
excuse
do so.
Do you have a pointer here?
Yeah.
Could you use that?
Yes.
Thank you so much.
Thank you so much.
Do you see this person right
Yes.
here with the dark pants and the white top and the multicolored graphic on the back?
Yes, I do.
Do you know who that is?
I cannot tell, no.
And where were you while this frame is being seen?
I believe I'm in the far back.
In the far back,
So-
when you say in the far back, behind this group of people?
Yes, behind that, yes.
And you see Mr. Hines here,
Correct.
and you believe at this point you'd already been stabbed.
Correct.
You believe Mr. Hines has already been stabbed.
Correct.
Can we play forward to 112? You see a person on the ground here, Mr. Connery?
Yes, I do see that.
Do you believe that to be Tyler De Silva?
I can't tell in this, but
Well, you described him before as wearing a blue baseball-style jersey, correct?
yes.
And can we play it to 135?
Sir!
Here we are at frame 135. You see the gentleman with the white shirt, multicolored graphic on the back, and the dark pants to the right?
Yes.
You see beside him a person with a dark shirt, light shorts, and some light shoes.
Yes, I do.
You see beside him another person, dark shirt, light shorts, white shoes.
Yes.
Would you agree that this person that we've just described in the dark shirt, light shorts, and white shoes is going to the left of the screen towards this altercation happening to the left?
Yes, it looks like that.
Would you agree that these other folks we've described, these two on the right-hand side, they are participating in something that's going on to the right side of the screen?
Yes, they look like they're looking that way.
And do you see on the far left what we've already identified before as being Enrico Fiola holding a camera?
Yes.
And can we play that ahead to frame 182, please? This is frame 182. Would you agree that's the still shot that we've seen earlier when you were shown the exhibit? Oops. Easy for me to do. Would you agree?
Yeah, it looks similar to it, yes.
Right, because we see Enrico Fiola here again, right? He's looking towards the screen. We can see the light in his eyes.
Yes.
And he's, again, holding the camera, correct?
Correct.
And there's, again, this person on the ground, which I believe earlier you identified as being Tyler Da Silva.
Yes, that's him.
And that's Tyler Da Silva on the ground, correct?
Correct.
And then, can we play it forward? Just a frame or two ahead. One more. I'm sorry, can you back that up to maybe 180? 180? Yep. And one more. Okay, there we go. Ooh. Do you see here, again, Mr. Hines with the black shorts, the white trim, and the green top?
Yes, I see him.
What is he doing there?
Standing over the kid on the ground.
Can we play that forward to 183? Sir, would you agree that he is kicking that person that is on the ground?
It looks like he's doing something.
Doing something, but you're not sure what.
Yeah, it's hard to tell.
All right. Can we play that forward? Then I'll just ask you when to stop her. Thank you. Can you stop? Do you know who this gentleman is that's standing here in the front of the frame with the white shirt and looks like some sort of dark bottom?
It's hard to tell with the light on his face.
Okay. Can we play that forward just a little bit more? And again. Stop, please. Any idea who that was?
It looks like someone named Alex Zaborek.
I'm sorry?
Alex Zaborek.
Alex Zaborek.
Yes.
Do you remember him being there that evening?
Yes.
Did you tell anybody about Alex Zaborek being there that evening?
No one has asked me about him.
No one's asked you about it. Can you play that forward again? Can you pause it there? We're at frame 332. Do you see that, Mr. Connory?
Yes, I do.
And do you see here to the left, standing beside somebody with their camera out, Ryan Hines with the white trim, black shorts, green top?
Yes, I see him.
Do you see Mr. Da Silva on the ground with his baseball jersey up over his head, hockey style?
Yes, I see that.
Do you see Alex Bernson leaning over him?
Yes, I see that.
Do you see Michael Sampieri also coming towards him?
Yes.
Is this your brother coming into the frame here from the right-hand side?
Yes, it looks like it.
Can we play that again, forward ahead? And can we pause that? And do you see your brother being followed by this gentleman in the gray top with the dark shorts?
Yes.
Who did you tell us that was before?
Joey Romano.
Joey Romano. Did you tell anybody that Joey Romano was there that evening?
No.
You weren't asked?
No, and no, I was not asked.
Do you see this gentleman here with his shirt off and the dark-colored, maybe camouflage shorts?
Yes.
That's Matthew Lokovich?
Correct.
Okay. And he's in a group, you would agree, with Mr. Romano and your brother?
Correct.
Can we play that forward again, please? Can you pause it, please? Do you see right behind Mr. Lokovich a person with white shorts and a dark top?
Yes, I do.
You believe that to be Mr. McGrath?
Yes.
Can you play that forward again, please? Can we pause it there, please? And you see Mr. Hines standing to the left of frame 400, correct?
Correct.
Green top, black shorts, white trim, correct?
Correct.
Jacob Villalobos shoving Mr. Da Silva, correct?
Correct.
You see the leg and part of the body of Mr. McGrath, correct?
Correct.
And he's standing in close proximity to this group that is shoving Mr. De Silva away. You would agree?
Yes, somewhat close.
Can we play that forward, please? Can we pause it there, please? We're at frame 490 now. Can you see that?
Yes.
Where were you located when that was going on?
In the back area where I was saying before, behind the crowd.
Still behind the crowd.
Correct.
Are you laying down at this point?
No, I was not.
What were you watching at this point?
I was just in shock and just staring off.
You still see Mr. McGrath here in frame 490, correct?
Correct.
Where were the rest of those people that were just with Mr. McGrath?
They're to the left of him.
You could see them?
No, but just from the last clip before.
You're inferring that they didn't just disappear.
No, they did not disappear.
I'm just going to hand this back to you.
Okay. Thank you.
Now, is your testimony that, at least when you saw Mr. Hines engage with Mr. Valley, that they were just tussling and there was no punches, correct?
They were tussling. I didn't see punches or anything else.
Did you see Mr. Hines kick anybody?
No, I did not see him kick.
You didn't see him punch anybody?
I didn't see punches.
Did you see him tackle anybody?
It wasn't tackling. It was just tussling. I don't know how to exactly describe it, but they were going at each other.
And after you claim to have separated them, did you see Mr. Hines go and do any of the things that we just saw there on the video?
No, I was not looking for that.
You couldn't see any of that.
No, I was not looking for it.
Did you see Faison Teal stomping anybody?
No, I was not looking for him.
And it's your claim or your recollection that you were stabbed even before the video started.
Correct.
And it's your claim that there were only 3 people involved in the fighting.
From what I saw, from what I was looking at, the angle I was at, yes.
And that most people are just sitting watching.
From my point of view, correct.
You were dressed similarly to Mr. McGrath that evening?
Different color shorts and no logo shirt.
Dark top?
Yes.
No logo on your shirt?
Nope.
White shoes?
Correct.
Light gray shorts?
Correct.
All of the kids that were there at that party that night, other than the kids who showed up in the pilot, were very close friends of yours, were they not?
Yeah, they were, I wouldn't say super close. Some were closer than others, but they were friends of mine, yes.
Many of them you had grown up with since childhood, correct?
Correct.
You would get together almost every weekend over at Mr. Rich's house, correct?
Not at his house, but we would get together with everybody every weekend, different places.
Different places, but engage in a similar sort of party wherever those places were, correct?
Not every weekend, but here and there, there'd be something to do.
And when you would get together, there would typically be drinking, you told us?
It depended on the situation.
And you wouldn't want to see your friend's reputation or memories be harmed in any way, would you?
No.
After watching that video the way we just watched it, does that change your recollection of anything that you've told us?
No. What I remember is what I remember.
Thank you. Nothing further.
Thank you.
Attorney
I
Johnson.
have questions.
Counsel just asked you about this video.
Correct.
This is frame 252. Do you know who that is by the car?
Yeah, that's Raul Valley.
You didn't see that, right?
No.
At the time?
No.
But you know that now?
Yeah, I know it now.
Can you play the video, please? Stop. And frame 287 on the ground, that's Tyler De Silva, right?
Correct.
But you didn't actually see that at the time of the video, right?
No.
Play it. Stop. Now, frame 397, who is this individual starting to push Tyler De Silva out into the street?
Jacob Villalobos.
Play it, please. Stop. Now, frame 416, who is that stumbling out towards the street?
Towards the street is Tyler De Silva.
Who's directly behind him?
Raul Valley.
Do you remember that happening on the night in question?
No.
And who is this individual standing by himself right here on the left side of the frame?
The one with his arm right
Yes.
there? That's Jimmy McGrath.
And was it at this point that you looked over and you saw Jimmy McGrath stabbed?
No, no.
Play it, please. Stop. Who's standing out in the street all by himself in frame 453?
Tyler De Silva.
That's not the defendant right there?
No, that's not the defendant.
Play it, please. Stop. Now, this individual on frame 489, who is this right here?
I'm sorry, you're blocking my
Frame 489 on the left side of the frame.
That's Jimmy McGrath.
Okay. Standing all by himself?
That's what it looks like.
Do you remember seeing this happen on May 14th of 2022?
I saw him standing by himself, but after this, after they drove away.
Okay. Can you please play it? Stop. Frame 533. Do you see Mr. McGrath?
Yes, I do.
What does he appear to be doing at this moment?
He's backing up away from something.
Did you see that happen on May 14th?
No, I didn't see that.
Who is next to Mr. McGrath in this frame?
Tyler De Silva.
So, you remember certain things happening that night, but not everything that you saw in the video.
Correct.
Is that fair? Safe assessment?
Yes.
So, at what point in time do you remember seeing Mr. McGrath after you realized you're stabbed?
So after I realized I was stabbed, they have already driven off, and actually he was standing somewhere near where he is in this video, and that's when I saw him stabbed and fall to the floor.
You saw him lift up his
He
shirt?
pulled up his shirt, there was blood, and he just dropped.
Now, counsel asked you a little bit about you giving a statement to the police about the defendant making eye contact with you just prior to him coming towards you and hitting you in the leg, right?
Correct.
Describe why you said what you said.
Because the way he looked me in the eyes, no one's ever looked at me that way before, and it was, now when I think about it, the punches that I thought were being punches was someone who looked at me knowing what they were going to do.
So, how would you describe withdrawing it? When he looked at you, is that the moment that he came towards you?
Yeah, we made eye contact and then we engaged.
So, describe how, when he made eye contact with you, how he engaged you.
He was on literally bent over, as I described before. He looked me up right into the eyes, and I looked at him, and then he came right at me with the leg, and that's when he was doing the hooking motion into my leg.
And when he came at you, what was your reaction to that?
I immediately was doing the thing, get off, like this.
Okay. And when counsel asked you the fight just stopped, what did that mean, the fight just stopped? It didn't just stop.
Me and him had our separation, and then that's when I stood there in that back just looking around in shock.
And when you were in shock, what were you doing? Were you focusing on what was happening
I
around
think
you?
I don't recall exactly what was happening around me because my body was just telling me, like, you're hurt, figure out yourself. So I was just sitting there, standing.
Were you engaged in who was around you and taking notes on all your friends around you?
Not at all.
So when counsel asked you, was Matt Lockovich there, and you said you can't recall. Why did you say you couldn't recall?
Because that night I was not thinking, where is Matt Lockovich right now at this moment?
And when he asked you where Mike Samperi was at any particular moment, why weren't you?
I wasn't thinking, where is Michael Samperi?
And how about where your brother was?
I thought I already had pulled my brother out.
And what about where Jimmy McGrath was?
I wasn't thinking, where is Jimmy McGrath right now?
And how about any of your other friends that have been mentioned?
Not a
during
single
your
person I was
testimony?
thinking about, no, not where they are.
So with regards to when counsel asked you about when the car initially drives up and people say someone's out in the front yard or the car's here and you walk out into the driveway, but you stand at about, I think, 30 feet away, how many people were around you that were from the Shelton party?
Like I said, there was 10 people in the driveway around me,
How
about
many people were close to the car?
another 10.
And at that moment, were you taking notes about who was to the right of you, who was to the left of you?
Not at all.
Why weren't you taking note of that?
Because I was taking note of who were the people that were not supposed to be here in the car.
So where was your main focus at that point in time?
The people in the car.
And with regards to when you go back into the house and then you come back out a second time, remember when you just testified on cross that the car was down the street and you
Yeah.
come down the tree line area?
Correct.
So I think your testimony, this is State's Exhibit 49, testimonies you were somewhere down near the second red bush towards the street?
Yeah, correct.
Down the street. You remember when counsel asked you about, do you recall Faison Teal was in the yard at that time?
Yes, I remember that.
Do you remember what your response was?
No, I did not see him. I do not recall seeing him.
Why didn't you see Faison there?
I wasn't in the yard. Hey, where's Faison Teal? Thinking that.
But was Faison Teal at Tyler Rich's house?
Yeah, he was at the party, yes.
You just can't recall whether or not he was in the yard at that particular moment?
No, I cannot recall.
Could he have been at the yard?
Sure, he could have been, yes.
Maybe you didn't see him?
I wasn't looking for him.
So, with regards to anybody that may have been around you, in addition to Faison Teal, again, was your focus on your friends around you or what was happening down the street?
I was looking down the street. I wasn't thinking who's next to me in this moment.
Now, with regards to one final question. Counsel asked you about this picture. State Exhibit 57. Recall that?
Yes, I do.
Do you know where that picture was taken?
Yes, I do.
Where was that picture taken?
Mr. DeJesus' house?
You didn't take that picture, right?
No.
How do you know that this is Mr. DeJesus' house?
I've been over there before.
Okay, and when you say Mr. DeJesus, who are we talking about?
The father, the person who owns the house.
Okay. Do you know if Mr. DeJesus has any children?
Yes, he does.
And who are his children?
He has 3 boys and 1 daughter.
And are you friends with any of his
Yes, I am.
children? Who are you friends with?
Nicky DeJesus through my brother, and then Joey DeJesus because he's older than me.
And was any of those individuals at Tyler Rich's house then?
Yeah, Nicky was.
Nikki was?
Yeah.
So when you're referring to Mr. DeJesus, who's 50-something years old, you're talking about the father, not the son?
Yeah, the father.
Okay. All right. Thank you. I have no further questions.
Thank you.
You were just asked about when you had been out in the driveway looking across the way. There were 10 of you in the driveway, you recall, and another 10 across the street with the car, correct?
Correct.
And you told us you were just focused on who was in the car that wasn't supposed to be there, correct?
Correct.
And that's why you didn't see anybody rocking that car, correct?
Correct.
That's why you didn't see anybody put their hands on that car, correct?
No, I did not see that.
That's why you didn't see anybody throw anything at that car, correct?
No, I did not see that.
That's why you didn't see any of your friends do anything to that car that night, correct? Because
No, I did
you were
not see
just
that.
focused on who was in that car.
Correct. I was focused on who
So
was in it.
focused that from 30 feet away, you could tell us, despite the 10 people being in front of you, that Jack Snyder was the driver and Mr. Valley was a passenger, right?
Yeah, I had a sight on them. I looked at them, and that's what I acknowledged.
Thank you. Nothing further.
When you noticed the defendant and Jack Snyder in the car, did you hang out there the whole time, or did you make your way back into that?
No, I went inside.
Okay, so you didn't stay outside the entire time during that
No, there was
time?
already so many people out there. I didn't need to be out there.
No further questions.
Nothing further.
All right. All right. You're dismissed, Nick. Thank you. Just watch your step as you exit, okay? Thank you. Attorney Messina,
Thank you.
the state's ready.
Call Dr. Roselle Crombie to stand, please.
Thank you. Good afternoon. Yes, please step into the witness box and remain standing. Madam Clerk, to my right, will put you under oath. Thank you.
Please raise your right hand. Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the evidence you shall give concerning this case shall be the truth, the whole truth, and nothing but the truth, so help you God, or upon penalty of perjury?
I do.
Thank you. Please state your full name, spelling your last name.
Roselle Crombie, C-R-O-M as in Mary, B-I-E.
Thank you. And please state your business address.
My business address is, it's 888 White Plains Road, second floor, suite 206, Trumbull, Connecticut, 06661.
Thank you. You may be seated.
Hi, Dr. Crombie. How are you today?
Good afternoon, Tatiana.
Good afternoon. It's a little bit difficult to hear in this courtroom.
Okay.
So as much as you can keep your voice up, we appreciate
Sure.
it. So thank you.
Absolutely.
Dr. Crombie, what is your current profession?
I am a surgeon.
And explain to the members of the jury what degrees you hold.
I hold several degrees. I have MD, MPH, which is a Master's in Public Health. I have a FACS, which is a Fellow of the American College of Surgeons, and FABA, which is a Fellow of the ABA. I'm double boarded in general surgery and surgical critical care, and I am fellowship trained in burn surgery, which is traumatic burns and reconstructive plastics.
And what hospitals are you affiliated with?
I'm part of the Yale New Haven Health System. My primary home hospital is Bridgeport Hospital, but I do also at times go down to Greenwich Hospital. And many years ago when I first started, I was at Yale New Haven Hospital.
In Bridgeport Hospital, that's located in Bridgeport, Connecticut.
That's correct.
And how often are you at Bridgeport Hospital?
At this point in my career, most of my practice is outpatient ambulatory surgery that's done at Park Avenue Medical Center, and then I'm on service, meaning in the hospital to cover burns a certain number of weeks per year. But about once a week, I cover on-call, which means that for a period of time, my surgical group has to cover trauma, general surgery, surgical critical care, burns, and wounds over a period of time. It's typically a 30-hour shift.
And for how long have you been affiliated with Bridgeport Hospital?
I'm at the end of my 16th year of practice, so it's been a very long time.
And if you can give us a rundown of your work experience.
My work experience, it's all of those specialties, in addition to some outpatient and ambulatory surgery as well. So it's general surgery, burns, trauma, critical care, which means people that are sick or very sick on ventilators, need a lot of vitals. I do wound surgery. I do a lot of reconstructive plastics as well.
And could you please explain to the members of the jury in what capacity your expertise is needed at Bridgeport Hospital?
Primarily for burns is what I'm renowned for. If you look up my name nationally, but additionally, again, I do reconstructive plastics. I cover trauma when I'm called to about once a week. Whatever comes in through the emergency room that needs addressing by a surgeon at certain times.
In your specialty of trauma, explain to the members of the jury, are you in one particular department at Bridgeport Hospital, or are you called into any department when needed?
Good question. So a lot of the general perception is that we're just sitting there in the emergency room, and that's exactly not what happens. So I'm a surgeon. I'm part of the Department of Surgery, Surgical Critical Care, General Surgery, Burns, Wounds. I know I keep repeating, but just to stand the point, when there are different types of consults that come throughout the hospital or outside of the hospital, and we're called to either different floors or different sections of the hospital, then we go and we see the patient and we evaluate them. Sometimes it's up on the 10th floor where there's a cardiology issue. Sometimes it's in GI or gastroenterology. Anywhere where there is a need for either any of those particular specialties that we cover, that's where we go. And the emergency room obviously is one as well.
Have you testified in court before?
Multiple times.
And do you have any teaching responsibilities?
I do. I'm faculty at Yale School of Medicine, Department of Surgery.
Does that involve teaching residents? And
It
whatnot?
does, yes. Many residents, we got over 100.
Do you belong to any professional societies?
Multiple professional societies. So the American Burn Association, the American College of Surgeons. I also belong to a number of wound societies as well. I'm chair of the Physician Special Interest Group for the American Burn Association. I am on I'm a board director at large for the American Board of Wound and Surgery, effectively. I'm the chair of a conference that's called the John Boswick Symposium, named after a former burn surgeon. So I do quite a bit at the national level and also within the state of Connecticut, the American College of Surgeons within the state of Connecticut.
I'm going to direct your attention to May of 2022.
Yes,
Do you recall working at Bridgeport Hospital at that time?
I do.
And at any given day or night, how many patients would you see?
So I'm on call tonight. I was on call Saturday. I'm typically the Tuesday person or the Saturday person. It can be anywhere between typically 17 and 20 consults, and then I'm covering about 60 to 65 patients that are on the floor. In addition to that, if anything emergently needs to go to the operating room that needs to be addressed, then I'm also operating on that as well.
What you just recounted, was that about the same way in 2022?
That's a typical night on call for me.
And directing your attention specifically to May 15th, the early morning hours, May 15th of 2022, do you recall working at Bridgeport Hospital on that morning?
I was the overnight person, yes.
And overnight, what hours is that again?
So we usually, in addition to working a regular day, which for me starts about 7 a.m. operating, at about 4, somewhere between 4 and 6, I have to come back to the hospital and relieve my partners that have been covering the hospital. And then I cover all of those services until about 8 a.m. the next morning. So it covers the overnight shift, effectively. Each one of us takes our turn. That happened to have been my turn.
Did there come a time when you examined a patient by the name of Thomas Connory?
Yes,
And do you recall reviewing Thomas Connory's medical records before testifying here today?
I did.
May I approach counsel, Your Honor? Approaching the witness. Dr. Crombie, I'm going to be showing you what's marked as State Exhibit 81 for ID purposes only. Just please review this and let members of the jury know, what is that document?
This is the medical record of the said patient, Thomas Connory. It gives a medical record number, which is a number within our Healing Heaven Health System and a date of birth, 11/27/2023, and it is the contents of what is taken out of our electronic chart now since 2015, but the government required us to be electronic and it's printed into paper.
Were those records made in the regular course of business of Bridgeport Hospital?
Yes,
And is it in the regular course of business for Bridgeport Hospital to record such documentation?
it is.
And you had an opportunity to review these records before coming to court today?
I did.
And are those records the same records that you that were generated on the date of service, which was May 15th?
That is correct.
And are these records certified?
Yes.
I'd ask that you marked as a full exhibit.
Attorney Smith?
No objection, Your Honor.
All right, court will accept into evidence dates 81 full.
Dr. Crombie, giving you back states 81, which is now a full exhibit. You can now reference states 81. Dr. Crombie, looking at case 81, when was Thomas Connory admitted into the hospital that morning?
5/15/2022, I recall that it was just at the turn of midnight is when we got paged
Okay. And to your knowledge, how was he brought to the hospital?
by ambulance.
And where was he brought upon his arrival?
Oh, in the ER, there is an ambulance bay where the EMS providers bring them down the hallway and it goes into a trauma room. We have 3 of them, and effectively they're just big rooms that have a lot of equipment that we might need for emergencies or anything that we need to do.
When Thomas Connory arrived, did he arrive as any kind of specific level, meaning a trauma level or something otherwise? And how do you know this?
So the American College of Surgeons and the American Association of Society of Trauma, they grade the levels of trauma on 3 levels. So the lowest one, meaning that you can just consult the physician, it's not emergent. The second one being that there are some injuries that may be concerning and we require certain people to be there. And then the top level, which means that the patient is in extremis. Everybody should be there, including respiratory anesthesia, surgery. Everybody that is needed possible. It denotes a call to the blood bank, et cetera, et cetera.
Do you know what level Thomas Connory came in as?
I believe he was a trauma alert, which is the mid-level.
And from your experience and expertise, why was he labeled as a trauma alert?
So per the criteria of the American College of Surgeons for certified verified trauma centers, because he had a penetrating injury of some sort, he immediately bumps up to at least a 2nd level, maybe even a 3rd, depending on a bunch of different factors.
Would that be for all patients who come in with similar injuries such as his?
Penetrating trauma does trigger the 2nd level.
And please explain to the members of the jury how you came about, how you were asked to assess his injuries. How were you called to assess his injuries?
So in a typical night on call, I'm the attending on call. I have a chief resident, which is anywhere between a PGY3 and a PGY post-grad year 3 to post-grad year 7, basically. And then there's a mid-level resident, which is the person that primarily covers any consults that come through the ER or any emergencies like this, and then an intern. So what typically happens in many hospitals throughout the United States is that the mid-level or the consult resident goes and evaluates the patient. There's also a separate residency program called the Emergency Medicine Residency Program that also evaluates the patient, and it's part of both the learning process and the incredible need to have multiple parts to patients' care in medical care. And the mid-level resident, we all got the page. The mid-level resident then speaks to the chief level resident, and then they evaluate the patient and call me and give me a head to toe. And then I go and examine the patient.
I'm going to direct your attention to State's Exhibit, I believe it's 81. Page 2, under where it says History Chief Complaint. Can you please read what it says under that line?
Stab wound, multiple stabbings to the left thigh, trauma alert called at 0042, so 12:42 a.m., direct to trauma 4, which is one of our main trauma rooms
Is
in
that
the
trauma
ED.
room was
4.
trauma 4?
Correct.
And how many do you have at Bridgeport
We have
Hospital?
3
Okay.
that are active, but we can spin to more than that if needed in a mass casualty incident.
I'm going to direct your attention to States 81, page 6, towards the bottom of that exhibit under the heading ED Notes by Messer Marissa RN. Can you please read what it says there, starting with the sentence on assessment?
So on assessment, the patient with 4 puncture wounds to the lateral aspect of the left thigh, inferior and superior wounds with hematoma, bleeding controlled, pedal pulses present bilaterally, cardiopulmonary monitoring initiated, VSS, which means vital signs stable, GCS is a measure of the activity and movement and response of the patient, IV access established in the right AC, which means antecubital, which is the inner part of the arm, lab work collected. Please refer to the trauma narrator for further documentation.
What does all of that mean that you just read?
Okay, let me break it down. The assessment we do, there's parts of a note in the way that we communicate in medicine, which is basically, and the medical students and the residents, they evaluate by hearing the history first, and then by doing a physical exam head to toe. And then there is an assessment, meaning based on the description of the history, the physical exam, and examination of all of the imaging labs, et cetera, what is your assessment? So this is the individual that wrote this, who is a nurse. This is what she is reporting as her assessment for this patient. So 4 puncture wounds, so 4 stab wounds, lateral aspect of the left thigh, so there's laterality, so there's left and right. Lateral means to the outside of the body, medial means to the inside of the body. So it appears that there were 4 puncture wounds to the lateral aspect, so outside of the left thigh. Inferior means, again, inside. Superior is above, so towards the top, with a hematoma, which is basically a collection of clotted blood. Bleeding is controlled, it appears, is what she is assessing. Pedal pulses means that she touched or somebody touched the bottom of the feet and examined the arteries there. And what that indicates is that there is good blood flow that goes beyond those stab wounds to the feet. And cardiopulmonary monitoring was initiated, meaning that they hooked them up to the monitor, which is blood pressure, O2 saturations, respiratory rate, amongst other things. Vital signs were stable, so they fell within a specific range. GCS is a Glasgow Coma Scale. It is a universal way that in the emergency room and surgeons communicate, and it's based on eye movement, verbal, and then overall movement. And there's a score, 15 is the best that you can get. The minimum we typically give if somebody is even deceased is a 3, because they got basically a 1 for nothing. IV access means that the nurses were able to put the IVs in the right arm, and then they collected the typical blood work that we do.
Thank you.
You're welcome.
Referring you to State's Exhibit 81, bottom of page 6 into page 7. Is this where your notations begin?
This is part of my note. Yes.
Okay. And is that your electronic signature on this documentation?
It is.
Okay. And you personally examined Thomas Connory, is
I
that
did.
correct? And on that same Exhibit 81, where it says pre-hospital information, what does that refer to?
Pre-hospital information means that before they got to the hospital and rolled in, emergency medicine services are also providing some type of medical care, and they're documenting that in some capacity. Now, I don't see anything other than when the patient rolls in, so I know nothing about whether or not that's valid or invalid. It just is.
And emergency medicine services, that's EMS?
That's correct.
Okay. And it indicates here on States 81, page 7, arrival time and exam time. Is that when you actually examined Thomas Connory?
No, as I stated before, the way that it works is based on the grading of the system. He is a middle grade, so I don't technically need to examine him for a certain period of time. If it's the highest grade, we have to be there within 15 minutes.
Moving to page 8 of States 81, what is the difference between a primary survey and a secondary survey that is listed there?
So again, with the American College of Surgeons and the trauma, a primary service survey means primarily we're identifying the things that can kill you. So airway, breathing, and circulation. And so those are the primary survey that we have to evaluate. Airway, I'll give you for an example. So if airway is not working because they don't have a breathing tube in, you stop there. You cannot move on to identify whether or not they're breathing, because they may not stop breathing until you have an open airway. So that's the time that we get anesthesia to come in, put a breathing tube. And then you keep going down until you're done with circulation, evaluating all the vessels throughout the entire body and making sure that they have good pulses. The secondary survey is then after you've got the patient stable and you've got all that documentation, is really looking at things like eye movement. Do you have blood in your ear? Are there any other deformities because of fractures and stuff like that? So that's all documented as a methodical way so that nobody misses anything.
Now, prior to you assessing Thomas Connory that morning, had you had occasion to treat patients with stab wounds in the past?
I have.
And upon examination of Thomas Connory, were his wounds consistent with stab wounds to the thigh?
They were.
And do you base your conclusions on self-reporting, your personal observations, or a little bit of both?
In terms of that they were stab wounds?
Correct.
So it's a little bit of both, but there are also some imaging studies that are done. And within the imaging studies, things that we're looking for are communication of air into the deeper tissues. And he did get what we call a CAT scan. So it's evaluation of the actual soft tissues and bones that showed that the injuries on the skin were consistent with a deeper injury down below.
I'm going to direct your attention back to States Exhibit 81 on page 9. Are those notations a continuation of your secondary survey of Thomas Connory?
They are.
and directing your attention to page 9 under where it says extremities. If you can please read that to the jury and then explain why this was concerning to you.
Sure. So this is an evaluation of the extremity on the secondary survey. Left thigh with 4 stab wounds with no active exsanguination, meaning no active bleeding at the time when we saw him. Inferior anterior stab wound, again, that's the inferior, so inside in the front anterior stab wound with a small hematoma, so small clotted blood. Range, ROM means range of motion intact at the hip joint, knee joint, and with the foot, meaning that his hip, his knee, and his foot moved completely normally for what we would expect of this age. No focal neurological deficits, which means that we tested both motor and nerve, and it was equal to the other side, and there was nothing missing. No vascular deficits, meaning that they were palpable with the different pulses, femoral, popliteal, dorsalis pedis. These are all anatomic as we're working down from the hip all the way down to the foot, with an ABI of 0.94. Distal pulses palpable and symmetric, except for, as noted above, no gross deformities or bony tenderness of the extremities. Normal passive range of motion, meaning that there wasn't anything inhibiting us from bending his legs, of the extremities without pain, except noted above, no abrasions, lacerations, contusions, ecchymosis, hematomas, or foreign bodies were noted on the physical exam. I just also want to point out the ABI, which is stands for the ankle brachial index, is another completely subjective where we measure the blood pressure at the brachial, meaning arm, and the ankle index. It should be equal and bilateral on both sides, and it should be 1. There are some elderly patients that have some vascular disease, meaning that they have smoked or they've got atherosclerosis. Sometimes you can have a decrease between 1, but in a normal young man, such as it should be close to 1. So in the area where the stab wound was on the left thigh, that limb was slightly decreased.
Why was it alarming to you?
So when you cut through a muscle, and if you think about it like a steak on end, there's a white thick tissue on the end called fascia. And what that does is as you injure the muscles, which are very vascular with a lot of arteries and vessels and lymphatics, they can swell to the point where it swells within that tight vascular tissue, that tight tissue called the fascia, and it can actually compress important structures like veins, nerves, and arteries. So that's why that number was concerning to me, because A, in a young man, it should not be less than 1, and B, it just shows that there's a significant amount of hematoma, meaning blood, that was starting to decrease some of the flow that was adding to our measurements.
In your professional expertise, would that be something that would be life-threatening, a life-threatening?
It can be life-threatening, and it also can be limb-threatening for a young man. So limb-threatening, meaning that as it starts to compress some of those arteries and veins, what happens is effectively it decreases the perfusion or the carrying of blood to the areas distal or further away from where the blood comes. The blood comes from your heart, it comes down into your hips where your femoral artery is, and then it goes out to the furthest point in the lower extremity. And what can happen is if the thigh is pretty muscular, if you continue to bleed, you can actually squeeze to the point where no blood flow is going down to below the knee or below where the thigh is. So that can typically in a non-responsive patient end up being an issue, and even in a responsive patient, it can lead to something called a compartment syndrome, meaning that the compartment is so tight that the pressures in the different area are damaging key structures, and that can ultimately, obviously, we call it ischemia, meaning not blood flow to a limb, and if it's not dealt with in a timely fashion, it can be devastating.
Now, directing your attention to page 11 to page 12 of SACE 81, at the way bottom of that page where it indicates soft tissues, there's a subcutaneous gas noted within the soft tissue of the anterior lateral thigh, best visualized on lateral view. What does that indicate?
That means kind of like I was describing for the CAT scan before. It just means that there was a communication between the outside air and the inside air. And what happens is, you can imagine, is just when I kind of akin it to like if you were cutting like gelatin. the knife goes in, and there's parts of it that will close, but there's going to be a track of air that communicates with the outside. That basically is illustrated by this picture.
And that would be indicative of a knife penetrating
Some
wound?
sort of, not specifically a knife, but a penetrating object.
At the very end of page 12, in States 81, it indicates attending comments that Thomas Connory was admitted for observation as the thigh muscles were highly vascular. Why was it important to keep Mr. Connory for a little bit of time at the hospital?
To make sure that he wasn't going to continue to bleed to cause that ultimate demise of what I was alluding to before, called compartment syndrome.
And at some point, in looking at page, I believe it's page 14 of States 81, there's a notation there from the nurse that indicates that at 3:15 a.m., dressings found to be drenched in blood, dressing changed with Sarah, who was one of the nurses. Is that a notation indicating that the wounds that Mr. Connory had sustained were still bleeding even
That's
after several
correct.
hours?
That's correct.
Dr. Crombie, are you aware of Thomas Connory, what blood was taken to be tested for anything at the hospital that
It's very standard for all trauma patients to have their blood
night?
drawn.
Standard, and why is that?
Because we are looking for not only to see how physiologically deranged they are, because often, despite the fact that our EMT providers are excellent, it just gives us a better clinical picture of what we need to do. But additionally, related to that, it gives us a little bit of an insight into some of the substances that may be masking some of the physical exam symptoms and the radiologic symptoms.
Directing your attention to page 23 of States 81, it does indicate that Mr. Connory's blood was tested, and it was tested for ethanol, which is alcohol. Do you recall what the level was?
125.
And what is that for BIC?
So blood alcohol level is a way for us to measure how what the law has deemed as being impaired, and 0.8 or 80 milligrams per deciliter is what's considered the impaired amount. I mean, obviously that's going to vary depending on your body mass and et cetera, but that's what's legally done. So technically at 125, he has an alcohol on board, and it's significant enough to cause impairment.
Is that a BAC of 0.125? Is that without the conversion?
0.125, yep.
With the fact that Thomas Connory had alcohol in his system, would that have affected his injuries or how he was treated at all?
So full disclosure, we don't get these numbers right off the bat. Like, this is something that comes afterwards, but it is incredibly helpful when it comes afterwards that then the team knows that they need to give more fluid and that the alcohol might be affecting the type of injury that he has. More specifically for him, it's just that he is intravascularly, so he bled, and then he's intravascularly dry because of the alcohol, because alcohol is a diuretic. It actually signals, it overrides your kidney's normal homeostasis or balance, and doesn't allow you to reabsorb the water when you're dry. It actually signals for you to pee, and that will make you drier, effectively. So that's the significance of that in him.
Okay. Being that you did not have these levels beforehand, did you see anything that was concerning to you that you thought maybe he had alcohol in his system, hence causing more bleeding, or he wouldn't heal as fast because he had alcohol, anything to that effect?
No, that shouldn't affect it.
Dr. Crombie, I'm going to show you what's been marked as, one moment. It's exhibit 77. Can you see that on your screen over there?
I can, yes.
This was a picture that was taken at the scene.
At the scene.
Do you recall if this is similar? Mr. Connory was taken.
It is similar.
Okay.
So we don't see these pictures, obviously, unless EMS has it.
Right.
I just see the patient as they roll into the emergency room.
And I just think one moment, Your Honor. Sure. Showing you what's been marked state 73. This was a photograph that was taken of Thomas's injuries about a week after, I believe. Are those consistent with where you saw the wounds the night of the morning?
Correct. They are consistent. So the left leg, and you can kind of delineate that because there was another leg underneath it that shows the right leg. Lateral is the outside of the leg, like I was saying, and those are the Those are 3 of them. There was one on the other side. So when we talk about this is the lateral, the opposite of that is a medial. There's clear description throughout the chart multiple times of an inferior medial one as well. And the significance of that means that the object, whatever it was, went through and through to, could have gone through and through to the other side. And that's the concern that I have as a surgeon.
So pointing to this exhibit, indicating here, I don't know if you can see that, which injury was this? You termed it as?
It should be superior lateral.
Okay. And pointing here to the middle exhibit.
That should just be lateral or anterior lateral.
And pointing to the lower end. Lower end.
It's technically inferior lateral because it's still on the outside of the leg.
Okay.
Yeah.
And the one we're not seeing here in this same exhibit is, you said, on the inner thigh?
Inferior, so inferior medial thigh. So inside thigh.
Now, Dr. Crombie, referring you back to States 81, page 12, under assessment plan, what does it say was initially done to help heal or tend to Mr. Connory's wounds?
So the wounds were washed thoroughly with betadine, which is an antimicrobial, and saline, which is effectively salt water. Xeroform gauze, which is a yellow gauze that has some bismuth salts in it, was applied and secured in place with Kerlix dressings, which are the types of gauze that you can kind of wrap around a leg.
Why weren't sutures used or stitches?
Good question. So I don't know what he got stabbed with. It could have been a branch, for all I know. And that is not sterile. That's got a ton of bacteria, a ton of stuff that might still be in the wound. So you do not want to close the wound, because then what that allows is to have growth of specific bacteria that are not, they're called anaerobic bacteria, so they thrive where there's no oxygen. So we always leave stab wounds open when we don't know what it is, how deep it was based on the imaging, so it heals from the inside out. So you just need to clean them, irrigate them out, and allow them to heal.
If Thomas had told you, or told one of the nurses that he had gotten stabbed with a knife, would you still have not put sutures? So even if it was a knife, not a tree branch as you indicated, would you still have had the same course of treatment?
Yes. I don't know how clean the knife is.
Okay. And I'm going to direct you, well, withdrawn. To your knowledge, do you know how long Thomas Connory was in the hospital for?
I don't know. I know that he came in around 12:54. I know that the dressings were changed at 3:15. That's why my note and my attending note doesn't match my resident's note, because I wanted him to be observed. So, and then what happens is 8 a.m. is there's a new team and a new partner of mine that comes and takes over.
But you do know that he was kept for some time for observation?
He was.
Dr. Crombie, I am going to ask you, in addition to treating Thomas Connory that night on May 15th of 2022, did you also recall tending to a patient by the name of James McGrath?
I did not know his name at this time, but yes.
And do you have a clear recollection of when James McGrath was brought into the hospital on May 15th of 2022?
Yes. So in my recollection, the way that we kind of described it in the surgery team is they both came in around the same time. What we have to do is identify and treat the more critically ill patient, which was, he was unidentified at that time.
Is it safe to say that James McGrath was, you tended to him prior to tending to Thomas Connory based on the level?
Correct.
Of the critical care?
So he came in as a trauma code, which is the highest level. So anesthesia was there, I was there, everybody that I mentioned earlier was there.
And how did your team initially know that he was coming into the hospital? Was it an alert that you had gotten from EMS?
So throughout the emergency room, and again, we're not there, there's something called CMED, which is a radio system that the EMTs and the paramedics and the ambulances do to basically triage and give a heads up for the patients that are coming into the emergency room. They had given them a heads up of the nature of how in extremis he was, how much blood there was on the scene. So that automatically bumps him up to a trauma code. So the way that I'm notified is I get on my pager, it says trauma code and gives a very brief description of what it is.
Okay. And why did he come in as an unknown? Explain that a little bit.
Oh, that's just if there is nobody at the scene that can identify them, very well, that's one reason. The other reason is it's unclear whether or not he's a victim of violence, and we also want to just make them an alias and be unknown so that we can just focus on that and not have to worry about all the other stuff.
Prior to coming today, did you have an opportunity to review medical records for James McGrath?
I did.
And when he came in, do you recall what his appearance was?
very pale and white, and he was on a Lucas machine, which is an automatic machine that performs CPR. There is a plunger that goes over the chest, and then there's an archway where they put the patient's arms to, and it's Velcro too. And the EMS can start and stop, as can the team. The Lucas machine is what it's called. And that allows the EMTs or the paramedics to focus on things such as fluids, managing his airway, et cetera, things that need to be done, yet CPR is being performed.
If it's noted that his appearance was toxic looking, what does that refer to, or what does that mean?
The nurses say that if for some reason the patient looks like they're either dead or imminently dying, but very sick, not good.
Do you know what the acronym ETT refers to?
Yes, endotracheal tube.
And what is that?
That is the breathing tube that gets put into your airway when you can't breathe for yourself.
And the term asystole, what does that refer to?
So there are different types of heart rhythms. Asystole means that there is no electrical activity that the heart is actually showing, nor is there any waveform that will transduce to the heart to be able to give meaningful pumping to circulate your blood.
From both your personal recollection as well as your review of the medical records of James McGrath, when the patient presented, do you recall what type of a stretcher he was in?
He was in a bucket loader stretcher.
And what is that?
So backboards are typically flat. If you've gone to any swimming pool, you've seen it on the side there, and it's to allow people when they fall down, emergency people, to be able to slide them onto some sort of board and fix their neck and make them secure and seatbelt them in. I don't know why he was in a bucket loader. I'll be honest with you. Maybe there was a lot of things going on at the scene, and that's the only stretcher that they had. But they scooped him up into that, and then they put him onto the regular rolling stretcher. So they brought him in, and we moved the bucket loader over to the ambulance, stretcher that fits in the ambulance comes in. They put it side by side with the emergency room stretcher, and then they move the patient over, whether it be in the bucket loader or typically just the backboard, over to that. And then we try to take the backboard off, but he was in such extremis that we didn't even, it was just really scoop done all the way into, and continued CPR.
So you immediately started working on him without even taking
There
him out of
was
the bucket stretcher?
there was no stoppage whatsoever.
Now, the term ED disposition, what does that refer to?
So at the end of the evaluation of care, sometimes we have to decide where we're going to put the patient. So like, for instance, somebody that needs ICU level care, their ED disposition is to the ICU. If they need to be admitted and they are floor level care, meaning they're not as sick, they don't need intensive care, then they go to the surgical or medical floor.
If it says ED disposition expired, what does that refer to?
So that means that the patient is deceased.
May I approach counsel, Your Honor? Dr. Crombie, showing you what's been marked as states 82 for ID purposes. Do you recognize this document?
This is the medical chart of Mr. Unidentified, who's now identified as James McGrath, from 5/15/2022.
Did you have an opportunity to review those medical records
I
prior to
did.
testifying here today? And were those records made in the regular course of business of Bridgeport Hospital?
They are.
And is it the regular course, Mr. Hahn, is it the regular course of business for doctors and nurses at Bridgeport Hospital to generate such a report when treating a patient?
It is.
And are they under an obligation to record information accurately?
They are, and I am.
And is it a certified documentation?
It is.
I would like to do this marked as a full exhibit.
No objection, Your Honor.
All right, court will accept into evidence states Exhibit 82, full exhibit.
Dr. Crombie, I have a few questions just to ask you about state 82, that will full exhibit. Let's reference those if needed. Direct your attention to stage 82, page 13. Is this where your notes begin in attending to James McGrath?
So it's page 13, halfway down the page. This is my history and physical note that is written after the event occurs.
And page 15 into 16 of that exhibit, attending comments. Just refer to
That's
that
me.
page. That's you?
Yes.
Okay. And if you could just please read what it says at the bottom there.
From my attending comments?
Yes.
Patient came from over 20 minutes away and clearly was on scene for greater than 20 minutes prior to that per EMS. The patient remained in cardiac arrest, meaning his heart had stopped per EMS and no other rhythm other than asystoles, which is what I described to you before. Since they had picked him up, a significant amount of blood was described at the scene. Head to toe exam, his pupils were fixed and dilated and non-reactive. Stab wound noted in the left chest axillary region. No other injuries were noted on the secondary survey. Patient was intubated, however, there was clearly food substance near the ET tube as he vomited on intubation per EMS. End tidal CO2 was confirmed and placement was confirmed of the endotracheal tube. Upon turning off the Lucas CPR assist device, there were no pulses noted in any of the proximal carotid or femoral areas. Asystole was confirmed multiple times between the Lucas device and self-performing CPR. One round of ATLS, ACLS was done to include treatment as well with bicarbon calcium in addition to the epi that was given. No return of any signs of life were noted. Again, it is confirmed on the monitor that he was in asystole, and an ultrasound evaluation of the FAST reveals no cardiac motion, so time of death was called. Father was told of the condition of the patient.
Referring to page 14 of your notes, where it indicates under chief complaint HPI, where it indicates patient was reportedly found on scene in extremis with asystole as his read. What does that mean?
So meaning that the first note of what the EMS does is they have their own monitors that are portable monitors, and when they hooked it up to his chest with all the leads in the proper area, there was no cardiac rhythm whatsoever.
And EMS, and he presented in extremis 30 minutes after starting CPR. On arrival, he had a GCS of 3. What does that refer to?
So that is the Glasgow Coma Scale that I was telling you about earlier, and it's an evaluation of eye, verbal, and movement. So his eye exam was not moving, he was not talking, and he was not moving. So that's a 3.
No palpable central pulses. That's pulses anywhere.
So central specifically means that the first place that your heart pumps to is your carotids, which are the 2 big vessels in your neck, and then your femorals, which are down in your groin.
And bilaterally dilated unresponsive pupils and ongoing CPR.
So what that means is when the brain does not have oxygen for a period of 3 to 4 minutes, you start to lose, your brain dies and you lose the ability to react to light. And that's seen typically in exactly this fixed and dilated unresponsive pupils.
Directing your attention to page states, I believe we're on 82, page 15 of James McGrath's medical records under trauma bay events, where it indicates resuscitation. Those 4 bullets underneath.
Yep, so epinephrine ×2, so they gave adrenaline, which is a drug that we typically give that is naturally occurring in our bodies in the adrenal gland to try to kickstart the heart. It was given 2 times with continuous CPR. No ROSC achieve means that there were no spontaneous live events that were no return of spontaneous circulation was not achieved. Cardiac ultrasound, we have a ultrasound in the trauma bay that can look at a bunch of different things, but we specifically looked at the heart and it was not moving whatsoever. And then patient declared dead at 12:52 a.m.
Dr. Crombie, who declared James McGrath dead?
It was technically my resident, but I was there supervising.
And do you recall who went out to tell James McGrath's father that his son had passed away?
So I immediately asked so there's a team that comes in with everybody, and we have pastoral care. We have pastoral care residency program. So they typically try to figure out where the family is. So I turned and I asked where the family was, and they brought me to where Mr. McGrath was. And
do you have a recollection of telling the father that his son had passed away?
I do, very vividly.
And directing your attention, withdrawn. Dr. Conway, there was some indication that James McGrath had an elevated blood alcohol level that night. Anything about that fact that would have affected his injuries or the fact that he had died
No,
regarding the alcohol?
no.
Would you have treated him any differently if
We would
he
have
had
not.
alcohol in his system?
We don't know that at the time, as I stated earlier.
And would he have still succumbed to his injuries even if the alcohol was present?
For this particular injury, yes.
And is there anything, Dr. Conway, that you vividly remember when you took, well, withdrawn? Was James McGrath ever taken out of that bucket stretcher and put somewhere else at some point?
Yes. So before I went out to go find Mr. McGrath, what we typically do to try to help the family see their loved one for the last time is the whole team, particularly the nurses, will clean up. It's a little messy after we've been working on somebody particularly that had bled significantly. So what we had done is all hands on deck because it was a big bucket stretcher, which is much heavier than it. And when we went to basically pull him, the bucket stretcher, onto a clean stretcher, there was liters and liters of blood that spilled all over the floor in the trauma bay, all over. It was in the bottom of that bucket. So we had to clean that up again, which is consistent with the type of injury that he had.
You have a vivid memory of that?
I do, because I did not want to go get his dad before we cleaned all of that up.
And final question, Dr. Crombie, from your expertise with an injury to the heart, such as the one that James McGrath suffered, what were the chances that he would ever survive such an injury?
Impossible, unless it happened in the hospital and we were right there to crack his chest.
Thank you. I have no further questions.
Attorney Smith?
Would you like me to begin, Your Honor, or would you like...
Do you have an estimate on how long the cross will be?
I think if Your Honor is okay with going perhaps a little past 3:30, that we should be able to complete the cross-examination.
All right, why don't we keep going then? Thank you.
Good afternoon, Dr. Crombie.
Good afternoon.
We've never met before.
We have not.
We've never discussed this case before.
We have not.
You are here to tell us today about the things that you did after the events that led to these injuries, correct?
That's correct.
And you were telling us that as part of what you did, that some blood was drawn from Mr. Connory, correct?
Correct.
You didn't know that at the time, but you told us that his blood alcohol level was a 0.125, correct?
That's correct.
And you said that 0.8 is considered impaired, correct?
Correct.
And 0.8 is considered impaired as far as for legal purposes, for driving, or for medical purposes, or both?
Well, it could be a little bit of both, and I believe it's 0.08 when we do the conversion over.
Okay. So a 0.08 is too impaired to drive under the law, correct?
Correct.
And is also, medically, is that a different sort of level of impairment than what we
It is.
use?
It
Okay.
is. So I guess I should explain that to you. So just like I was saying, like depending on your body mass index, depending on your age, depending on there is a enzyme in our livers called alcohol dehydrogenase, which breaks down the alcohol into the different components. And then the free components are what make us impaired. And depending on how fast those enzymes work, and then the size of our bodies has to do with the depot, and then our bodies, processing through that. The enzymes itself can be affected by multiple different factors, including any meds that you're on. Even if you were to take a Tylenol because you had a sore knee and you were 21 years old, it's going to be a little bit delayed in the metabolism or breakdown of that and clearance of that. In individuals that have a history of utilizing alcohol regularly, they tend to have more of this enzyme around and can clear it quite quickly, so they can seem very functional despite the fact that the legal limit or what's measured is significant. There are various tables on this, but there's various different things that affect that. But when this all evolved years ago, legally driving and operating motor vehicles was the 80 deciliters or the 0.08.
And in fact, it used to be higher than that,
It-
correct?
that's correct.
0.10. And it's
Yeah.
been lowered as
That's
we've
correct.
developed more information about the impairment effects of the alcohol, correct?
That's correct.
And when we have a BAC, that number reflects the amount of alcohol that's already been metabolized and is in the bloodstream at that point, correct?
That's correct.
And there's a fairly standard sort of metabolism rate for most people. Is that fair to say?
In general, yes, but just like I was saying with all of those different factors, and it's kind of like dive tables. They create them based on a bunch of different data, and they come up with the metabolism. You know, it's certain in an hour it should be this, and an hour it should be this, and another hour it should be this.
Have you heard that for a male, about 2 drinks per hour would get you to a 0.08?
It's again, there's some. I have heard that. I don't know if I necessarily think that that's totally accurate because when you say male, it could be a 5'2" male, it could be a 6'7" male. And it could be something that one guy's never had a drink in his life. This guy drinks regularly, so it's completely different.
Okay. Age can affect that as well?
Age can affect it, yes.
And you mentioned a dive table. What's a dive table?
For those individuals that do scuba diving, the Navy tested exactly almost similar to alcohol, the amount of nitrogen that is in your blood that precipitates out if you dive a certain depth. And they tested it on various naval individuals, and then very similar to the alcohol tables, they have a level of clearance per hour depending on the depth and the time that you were exposed to the oxygen.
Okay. And you told us that a 0.125 would indicate significant impairment, correct?
Well, I wouldn't say it's significant, but it is impaired, again.
Okay. So you don't recall telling us that that would be significantly impaired?
No, significant is 500, 600, which I have seen. That's significant.
500 or 600, that would be close to fatal, would it not?
Depends on the individual again.
A 0.50, half of their blood being alcohol, and that would not be fatal?
So it's not a half. So you think 0.5 is 50% of your blood volume. It's actually a measurement of the ethanol or whatever is in your system. So they measure it on an assay, and they actually, it doesn't mean 50% of your blood. Okay. It's an assay.
And at a 0.125, you said that may have some effect on his injuries as far as bleeding or things of that nature?
It has an effect, exactly what I was explaining before, is that it's a diuretic. So what that means is that he's legally drunk. Level of impairment, as we've just discussed, depends on the individual. But what doesn't depend on the individual is that alcohol signals you to pee out and override your kidney's regular homeostasis. So how that can affect your injuries is that if you're already dry to begin with, you have a certain blood alcohol level that your body's trying to clear. I'm assuming they aren't drinking water in between the alcohol that they're drinking. He's bleeding, and then in addition to that, his kidneys are peeing out, taking some of the intravascular volume out of his body. So that can affect your injuries.
Okay. At 0.125, would you also expect that to affect his ability to accurately describe how he'd come by these injuries?
Again, it depends.
Could
When
affect
I
his
examined him, he was telling me exactly what was described to him.
Could it affect his perception at that level?
It's hard to say. Again, it just depends.
Depends on the person.
It depends on the person. It's very different.
Would you expect somebody who had only had 2 beers a few hours beforehand to have a 0.125?
It depends. It has to go back to that alcohol dehydrogenase enzyme that I'm talking about, how active it is or how inactive it is. And then some of it is also just genetically, some people have more active alcohol dehydrogenase than others.
So you're saying that you would expect somebody who'd had 2 beers a few hours before you saw them to still have a 0.125?
It can happen.
Just 2 beers to get us to 0.125,
Depends on the individual.
even if it was a number of hours beforehand.
It depends. How do you know it was 2 hours before?
If that's what the person said.
It's hard to say.
It is hard to say, isn't it? It would be unusual. Would you agree with that?
I wouldn't say it's unusual, but it's possible.
And we also talked about a 0.20 blood alcohol content level. You recall that?
I do.
That is more than twice the legal level of impairment of
It
0.08,
is.
correct? And would you consider that to be a significant level of impairment?
It depends on the individual. So if it's a 6'8" football player, maybe not.
When you say if it was a 6'8" football player, why would a 0.20 not be significant impairment?
So, again, the way that the law, and I didn't make the law, deemed it is they took an average of individuals' impairments and they measured what their deciliter was. They did a bunch of tests and they said, do this cognitively, move this way, and that's how they came out with a 0.8. And that's now in a larger, more massed individual with a bigger liver, they can metabolize just better. Is the line, and if it happens to be an individual that has a history or has that genetic predisposition, each one of us is different. We're a mosaic of all of our genes. It depends on what their level of impairment is.
But you would agree that the law has said that 0.08 is...
To operate a motor vehicle
to impaired to
or
operate.
motor, yes,
Or both,
or both.
heavy machinery.
Correct.
And so if this jury was interested in why Mr. Valley did what he did that night, that's not anything that you could help them learn about, is it?
So I am here to describe the two patients that I took care of. I don't actually know who Mr. Valley is, I'll be honest with you.
Okay.
But I'm here to talk to you about the injuries that we treated that night and how we intended to save one of the victims.
Very good. Thank you.
You're welcome.
Any redirect? No redirect. All right, thank you, Doctor. You're released. Thank you. Just watch your step as you exit the witness stand. Thank you. Just a quick question to the state, if I could inquire, was that the last witness that the state had lined up for today, or do we have another witness to call?
I believe we actually have another witness if you want to start that witness.
All right, why don't we do our 15-minute recess then, and then we'll get started on that. All right, court's going to stand in the afternoon, 15-minute recess. Thank you.
All eyes, court